Hello, everyone. Welcome to the Oral Hygiene presentation part 1. My name is Tanya J. Ferguson, and I am your nursing educator at HFE, Health, Finance, and Education. This is a free workshop presentation that I've talked about in my video and my reel. So we are basically getting to it as of now. Like I said, it takes time and effort and planning, and here we are. So without further ado, I am going to jump right in. We're going to talk about the basics of oral hygiene, why oral hygiene is vital to our health, how to care for your mouth, how oral health is related to disease, and we'll do a quick review, and if time permits, we'll do questions. Oral hygiene, the importance of oral hygiene. Here we have a picture of a toothbrush and a child at the dentist's office. Okay, the basics of oral hygiene. What is it? Oral hygiene is the act of process of keeping one's mouth free from disease and clean regularly. There's no real reason why many people should have poor oral hygiene. Many may disagree with this, but everyone has a right to their own opinion. It is understandable if you live in a poor area where access is limited or unable to access at all. Oral hygiene requires a toothbrush and toothpaste, as you can see here, and also antiseptic mouthwash. It does have to have a good diet to go along with this as well. Remember, you are what you eat. Why oral hygiene is vital to your health? This answer is simpler than you know or want to believe. The mouth is where disease starts. A dentist can look in your mouth and tell what is going on in your entire body. It doesn't matter if you have cancer, diabetes, high blood pressure, or whatever. You have to remember one thing. It is all connected, the head to toe. The process takes place in the mouth and proceeds to go to the next level if it can. If some areas need improvement, the process is interrupted. Remember, we all have a part to play, and it starts with you and I. How to care for your mouth. Okay, I think I'm blocking this picture a little bit, and it won't let me move. But if I click on it, it's going to move my slide. But it's basically a picture of a little guy cleaning teeth. So taking care of your mouth does require some effort on your part. However, it is not a life sentence, but it can be a death sentence if not properly done. There are benefits to taking care of your teeth that you are blessed with, and there are consequences if you do not care for your teeth. You will need some toothpaste, preferably with fluoride, antiseptic mouthwash, and toothbrush. Most dentists recommend an electric toothbrush, but if you can't afford if you can't afford an electric toothbrush, a regular manual one will do the trick. You should take the time to rinse your mouth first. This will loosen up any food particles and kill any germs that have tried to make a home in your mouth. How to care for your mouth. Continue. Here is the antiseptic. And why I say antiseptic, because anti means not being septic. Get rid of the poison, the germs, the toxins. I think now they have a thing where because people were drinking the um Listerine and things like that, mouthwash, They go alcohol free. That's fine and dandy if you're not abusing it, but in my opinion, you still need that antiseptic. It does make a difference. Rinse your mouth by discarding the rinse into the sink. Remember to please rinse the sink each time. No one wants to come behind you and see what you had for lunch or dinner. This is truly disgusting. Place a small pea-sized toothpaste on your toothbrush and start to brush your teeth. Your mouth has four quadrants: left upper, left lower, right upper, and right lower. You should brush your teeth for at least 2 minutes. This means getting the gums inside and out. Don't focus on the teeth just yet, but please do brush your teeth. You want to massage those gums so that brushing below and above the gum lines. Massage the gums reduces inflammation, and we'll discuss this shortly. How to care for your mouth, part 3. There's one more and the most important part that I left out, and that is flossing. This is super important, and it can make or break you. It helps to get the food stuck, in between your teeth out. You will be surprised how much food and how food and how much food gets in between your teeth. And this is where all the danger, or should I say drama, takes place, especially if this step is overlooked. We have a picture here of someone flossing their teeth. It makes a big difference. Rinse your mouth out and repeat this process from there. Next, if you have never been to a dentist, you should make an appointment as soon as possible. How oral health is related to disease. As you can see, it's a picture here of a person that has buildup on their teeth. Some people call because it looks like butter. Some look worse than this. The answer is simple. When you don't take care of your oral health, it becomes a breeding ground for infection and germs. And what you see here is just the beginning. You can stop and reverse this. As you can see, if you look closer on the front teeth, you going above the gum line. On the bottom teeth, you need to go below the gum line. But you want to beat this by flossing and rinsing your mouth out and brushing regularly to stop this process. A battleground for your body to fight for its immunity to help keep you healthy. Think of your mouth like you trying to keep your sanity. It's a true fight when things get out of hand. Toothache, lost teeth, nerve damage, and above all, the cost to repair or extract. Small costs can equate to major and costly consequences. You can eliminate a lot of problems by visiting your local Dollar Tree or Dollar General store and brush at least twice a day. The recommendation is that you brush after every meal, but if you can at least brush twice a day under no cost, at least once. And if you can add that second part of the routine in twice, you'll get into a habit. Okay, like I told you, inflammation. Why did I start with this first? This is the cause of tooth decay, bad breath, and tooth and bone loss. As you can see here, we have a picture of someone's mouth. We'll say, ooh, a yuck mouth. but you can see the swollen gums, the tartar buildup. Inflammation is where an area has taken over by good germs and causes pain in that area. To keep it simple, if you have heard of arthritis, gingivitis, bronchitis, just to name a few, I use these examples for a reason. They are the most popular and heard of. Um, some may or may not have heard of these. Well, now you know. These words have what you call root and suffixes on them. They mean something. Just know that. Okay. I did put in speaker notes on these. Um, you will notice that um, anything with itis on it, it means inflammation. So arthritis, arth means joint. Itis means inflammation. So it's inflammation of the joints. Same thing. Bronchitis. Bronchial means lung or bronchial. Itis, inflammation. Gingivitis, gums, and that's part of the mouth. Inflammation of the gums. Then you have inflammation of the lungs. So, just to review, we learned in this workshop how to care for your mouth, the basics. If anything was missed, it can be learned or we'll cover it at a later time. This is just to help you get your feet wet and visit topics that are not talked about enough. We learn why oral hygiene is vital to your health, how it relates to diseases, and we know inflammation. Any questions you may have, you may put them in the chat or comment section or email them to me directly as well at nursingeducatorhfe@gmail.com. If you hit your control button on the keyboard at the same time and click on this link, you may send me a direct email and I will answer your email or present it on the workshop at a later time. I want to thank you for attending this workshop. I hope you attend more. And as I said before, we have a part 2 coming up. Until then, I hope you have a great and blessed day. Keep God first. And as always, wash those hands. Love you. Talk to you soon. And I'll see you in the next live session. Have a great day.